Pharmacies play a crucial role in our communities by providing access to necessary medications and essential healthcare services. However, many low-income areas face a crisis called pharmacy deserts, with limited access to pharmacies. This crisis affects communities of color, rural residents, low-income individuals, and families. Zarina Jalal, a pharmacist in the South End of Albany, New York, is trying to bring essential healthcare services to her community facing a pharmacy desert. Despite her efforts, she is facing challenges due to rising costs and declining reimbursement from Medicaid. The lack of pharmacies in low-income zip codes is a concern in Albany. These areas are densely populated with a high percentage of Black residents, yet they have limited access to pharmacies. This lack of access is also seen in zip codes with lower education levels, median income, and those who rely on public assistance. Zarina Jalal owns Lincoln Pharmacy in the South End, which serves as a vital resource for the community. It provides essential healthcare services, including filling prescriptions and offering advice on health and wellness. Despite the challenges faced by pharmacies serving low-income neighborhoods, Jalal's pharmacy is a lifeline for the South End community. Pharmacies serving low-income areas face many challenges, including switching to a managed care plan for Medicaid, which has led to decreased reimbursement for these pharmacies. This, combined with rising costs for labor and utilities, puts pressure on these pharmacies and threatens their ability to provide essential healthcare services. The following maps show the availability of pharmacies in Albany, specifically focused on the South End neighborhood. The first map shows the density of pharmacies in the Albany area. The second map shows the density of pharmacies by population concentration. This map shows the pharmacy density by persons 65 years and older. The fourth map shows the availability of pharmacies by education. This map shows pharmacies by persons without health insurance. The sixth map shows pharmacy density for people enrolled in public assistance programs. The seventh map shows people who lack pharmacy access by poverty status. The eighth map shows pharmacy density by median income. Now let's examine the demographic factors. The ninth map shows pharmacy density by Hispanic population. This map shows pharmacies by Black population. Finally, this map shows pharmacy access by non-Hispanic white population. In conclusion, pharmacies are essential for the health and well-being of our communities. Zarina Jalal's Lincoln Pharmacy is an example of the critical work being done to provide basic healthcare services to those in need. It is crucial for the government to support these pharmacies through appropriate reimbursement and to address the challenges faced by pharmacies serving low-income areas. Please subscribe to this channel to get more information about pharmacy deserts and what we must all do to address this incredibly challenging situation. Also, consider liking and sharing this information. It would help us address this situation and substantially improve the quality of life for all Americans, regardless of their zip code.